A very good morning to everyone. Today I'll be sharing with you the preliminary findings from our initial roundtable discussions on gaps. And if you know what gaps is governance, architecture, program management, standards, and interoperability. Okay, so we had a roundtable discussion on governance and also architecture, the first two, G and A, in on July 9, 2022, with 11 participants and one from via email. So these are the countries, and I'm sure some of you are here has participated in this roundtable. So in terms of representation, we had almost 54.5% from government. Academia was 27.3%, and from civil society, organization, and also associations, about 18%. And subsequently, just recently on September 17, we continued the roundtable with two more, which is the P and also the S. So we had the participants from these countries and one via email. And again, thank you to everyone who participated in this roundtable. And the sectoral representation, again, almost 50% government. We had a very high number of academia for this, 40% and 10% civil society. So now let me bring you through the gaps, which is the Charter of AeHIN. And let's start with G, the governance. Governance is IT application in healthcare need to be governed by the highest accountable officials. This means they define the expected benefits, the risks to watch out, and allocate resources. So what did we find? So how we have done this is we have put the best practices on one side and what are the main challenges. And I'm sure many of you can relate to this. And in terms of best practices when it comes to governance, there's been a lot of discussion, and what's important is to have a decision-making body that mandates the National Digital Health Oversight, and also setting up a multi-stakeholder National Digital Health Steering Committee, also keep propping up many times. Public-private integration, if applicable, also multi-stakeholder, and some of other things includes shared digital health goals and responsibilities, ensuring regulation and compliance by preparing relevant policies is also very important. Transparency and accountability, and also regular meetings and activities for digital health governance. In fact, when we spoke to some of the participants, a lot of them have emphasized on governance and stewardship of digital health in blueprint or in their strategic plan. It's not only for digital health. I think for everything, governance and stewardship is very important. But what are some of the challenges? Well, there was no clear governance structure, IT leadership, clinical leadership. Again, clinical leadership keep being discussed. I think that's very important, especially when you're implementing hospital information systems or a clinical information system. Without clinical leadership, it's very difficult to get success in these areas. And also lack in policy making that enables digital health. That has been coming out. Follow through in implementing plans and regulation, and lack of funding. It's interesting that I think we can all agree, no money, no technology. I think with technology and innovation, you really require funding, all right? And harmonization of insurance providers, client, digital health priorities also. Political changes also do play an important role. Political will is sometimes very important for a country to have reform and also digital transformation. There was also challenges in making digital health governance more inclusive, including multi-stakeholders, and also public and private. So basically, these were the findings, and I'm sure many of you can relate to this. It's almost similar in many countries. That's in terms of governance. Now let's look into architecture. ICTs in healthcare need a clear blueprint so stakeholders in a country will know how they can contribute to the structure as a whole rather than silos. In fact, many of our partners yesterday and today also spoke about architecture. Again, we have put it in the best practices and primary barriers. What's interesting is many countries talked about enterprise architecture and how people are scared about the word enterprise architecture. So to put it simply, in simplicity, we have advised perhaps you can use a word like blueprint. Everyone understand blueprint, but not many understand enterprise architecture. So that's how we can advocate, especially to our leaders and political masters. A whole of government enterprise architecture is very important. And I think COVID-19 has actually shown that you cannot work without everyone's involvement. And I think COVID-19 also made many countries move towards a whole of government approach. And also we're talking about enterprise architecture, focusing on business architecture, technology architecture in enterprise architecture. Also looking into dedicated team for digital health enterprise architecture. There are few countries who have created an EA office as a central office for any digital health intervention to develop the architecture. But it has many challenges. One is the misconception about enterprise architecture, and then lack of reference architecture. Of course, constraints in resources, as usual, funding, manpower, capacity. Capacity development is very important for enterprise architecture. You really need to create a team. But again, I always will advise you don't have to have everyone certified. You may just have one or two to be certified, but everyone must be aware of it and work towards it. So that's on enterprise architecture. And also some of the enterprise architecture blueprint is not adaptive enough for emerging technologies. More and more emerging technologies are being used now in healthcare, blockchain, AI, IoT, and so forth. But I think as we move forward, all this must be included. So that's in terms of architecture. Next, we go to people and program management. So ICT in healthcare require capacity building of key sectors, be it clinical, IT, administrators, working together to make it work seamlessly. Again and again, I would say people is the most important part of digital transformation. You cannot have technology interoperability without having human interoperability. So people is very important. Passion and dedication to digital health is very important. And that is what we are trying to create in AeHIN. So I will also say P stands for passion, right? Okay. So some of the best practices is digital health workforce based on strategy that works for the country. You can have a digital health program management office. I think Philippines have a very good PMO, program management office, and there are some countries who have management office but very based on project. It's not an overall. And some countries have it as an EA office where they look into all programs together. All right. And you can also have, of course, reference or responsibilities of the person and strategic partnership. Again, my advice will be from my own personal, government cannot do this alone. You have to work with the universities, academia, the private, the industry, and also the civil society, especially in technology and innovation. So you need everyone's help and collaboration to come together. But what are some of the challenges? It's due to a lack of organized digital health workforce. In fact, it's interesting yesterday when WPRO presented the competency framework. Perhaps we can also use that to see our health information workforce competency and how to further develop the team. And of course, siloed systems or lack of coordination. Again, it is very traditional that most IT will start as a silo system. But moving forward, like we have mentioned, interoperability has become more and more important. And then limited capacity in digital health people and program management. Again, our number of people, lack of skills and expertise, knowledge. So this must start from medical school and move on, you know. So we must also upskill our people, have new skill for digital health. And also, we are highly dependent sometimes on vendors. So it's very important to develop that skill. And finally, sorry, it's not moving. Okay, standards and interoperability is healthcare works, ICT in healthcare works best if standards are adopted and reused by all stakeholders. Let's look at the best practices. We had a lot on standards because many countries were already adopting or adapting to international standards or have their own local standards. So we really need a policy to support on standards and interoperability. You cannot do interoperability without having standards. So that's very important. Many countries who are using DHIS2 is also strengthening their information management system. Some countries were talking about sandbox and interoperability sandbox or interoperability lab presented by Alvin just now, our interoperability lab, and also establishment of a national data warehouse for use of data, standardization of terminology, so many out there, ICD, LOINS, SNOMED. So as a country, I think we must decide what we want to follow. And also registries and national IDs has been also spoken about. And also FIRE, I mean HL7, sorry, FIRE has been talking, we have been talking about that since yesterday. But conformance to standards is very important, and also a platform for electronic medical exchange or a health information exchange platform. And and also securing data and in terms of data anonymization and everything else when it comes to data governance. But what are main challenges? It's competing authorities, poor data quality, multiple data formats. If we are talking about exchanging data or interoperability, we must come to a consensus on the data format, on the terminology that's going to be used, and standardize processes and so forth. And also, and how there are many different ways of data collection. And also, we were talking about many systems and how do we integrate. It's very difficult. Long processes, yes, getting consensus is very difficult. Especially if where you have public sector, the academia and the private sector as separate, it's very difficult to get consensus. You really have to have a buy-in. You really have to go back to the governance, have leadership. So who's going to have that digital leadership in your country? Is it going to be the Department of Health or the Ministry of Health? Or is it going to be an agency? So back again to governance. And also good connectivity. I think COVID-19 has actually exposed the gaps, a digital divide, connectivity, and so forth. So having good connectivity is very important for interoperability. Trust. Trust has been spoken many times, if you realize, since yesterday and today. Digital trust is very important, especially people's trust, our citizens' trust in what we are doing in digital. So building trust has been a challenge. You need endorsement on policies, on standards and interoperability. Again, this goes back to governance. Who is leading the digital leadership? Who's leading the digital stewardship? And finally, we must have some minimum set of standards. There are sites where many countries have posted their national data, health data dictionary. So if you can get consensus in following this dictionary, I think you can get some form of minimum data standards. And also for sharing of information, for example, for discharge summary or event summary, it's also important to agree to the minimum data standards, have all the definitions and to be agreed upon. So basically, these are the 4 areas. So this afternoon, again, we are going to eat after this for lunch. So after lunch, we'll go into deep dive sessions where we'll have, today we will have the G and the A, the governance and the, sorry, G and the P. Oh, we missed the A. A is tomorrow, okay? So the G and the P this afternoon will be led by Alvin and Jai. And tomorrow we will do the S and the A, yes, A and the S by me and by Bunchai and myself. Tomorrow we will go into deep dive and there we can have a lot of discussion. This is only a preliminary findings of, from the roundtable. So with that, thank you very much and we'll see you this afternoon. Thank you.
Yay. Thank you, Fazila and the AeHIN Working Council and Executive Committee, Governing Committee. You can see really progress, but at the same time, alignments or even shared issues and concerns. And hopefully, in the we expect that in the discussion this afternoon there will be, solutions to all the issues that we are that we share.